Austin. This is my husband, Andrew Austin, who's agreed to be my guinea pig for student assessment video number 1. We're shooting with a GoPro here. It's a little bit of a wide angle, but hopefully it'll still come across okay. So we're going to start here with assessment of your skin, and we want to start with the skin of your chest and upper extremities. So his skin is nice and smooth and intact and warm. His skin trigger is, I want to look at your wrist here. Yep, skin trigger is, the test displays no tenting, and so that indicates that he has adequate hydration. Yeah, nice and pink, no lesions. Skin of his lower extremities here is also nice and smooth, warm, dry, pink, intact, no lesions. Hair distribution is equal, and there's no evidence of edema here on his feet at all. Very good. So now I want to take a look at the skin of your head and scalp here and face. So first of all, for temperature, your skin is nice and warm, not too hot. I'm going to palpate your scalp. I just want to make sure that the shape is nice and symmetrical, and it appears that it is. That's great. And there's no lumps or redness, no tenderness, right, when I palpated that. Good. So let me tip your head down here for me. I want to take a look at your scalp underneath your hair. So it looks like it's nice and dry, no flaking, no redness, no or rash or anything. Hair is nice and clean and thick and coarse. So very, very good there. So I just want to palpate here your sinuses. That doesn't hurt at all, does it?
No.
And then I want you to open it and shut your jaw. I'm palpating your temporomandibular joint. And you have a little bit of a click at the height of that movement there. Yeah, just like that. But otherwise the movement's nice and smooth with no crepitus. Okay, so now we're going to move on to your eyeballs here. So I'm going to test your optic nerve number 2. And we would do this first by testing visual acuity with a Snellen chart. So that's going to test kind of your long vision, your far vision. And so the way that we do that test is you stand 20 feet away from the chart. That's that big chart with the E on the center at the optometrist office. And I would have you read that chart with one eye covered and then the other eye covered. Andrew's vision is not corrected, so if it was, we would have it, you do it first uncorrected and then corrected. Now, the farthest line that you can read down on that chart with a 50% accuracy is your visual acuity level, and that gives you 2 numbers. So it's going to be, for example, 20 over 40 means that you could see at 40 feet what a person with normal vision could see at 20 feet. So then we would test your near vision with a Rosenbaum chart. So that Rosenbaum chart, you would hold, that's again near vision acuity. So you'd hold that chart about 12 to 14 inches from your face. And the same thing, you'd read the rows of letters until you couldn't read it anymore with 50% accuracy, and that would be your level of near vision acuity. And the normal for that chart is 14/14, where the normal for the Snellen chart is 20/20. So now I want to test your, here we go. I'm going to do a confrontation test, and this is going to test your peripheral vision. So I want you to cover up your eye here, and here, I'm going to cover this eye. There we go. And I want you to tell me when you can see this pen and your peripheral vision coming. Okay, so we're going to start here.
Yeah.
Okay.
Now. Now. Now.
Good. Okay, very good. And we would repeat that test bilaterally. So now we're going to test the nerves that innervate for the movement of your eye. So that's going to be cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens. So I'm going to start with, let's come back. The 6 cardinal positions of gaze. So I want you to follow my pen, the tip of my pen here. We're going to go out here to the side and up and down. Get back to the middle. Up and down. Very good. And no evidence of nystagmus, so that's good. That's a normal finding. With my pen light here, we're going to check your corneal light reflex. So I'm going to shine my light kind of right here in the middle. Make sure that I can see the light reflected on both sides. And I absolutely can. That's great. That's good. That's a normal finding. And then we're going to also do the cover-uncover test. So I want you to cover your eye. How about your shirt? Yeah. And go ahead and look over here, follow my finger, yep, and now uncover your eye. And his covered eye has tracked along with the uncovered, so that's good, that's normal finding as well. Okay, so now we're just going to do some inspection and palpation of your eye itself from here. So your eyebrows and your eyelashes are nice and full and equal on both sides, that's great. Open your eyes for me. Your eyelids are nice and even. There's no evidence of lid lag or droop or ptosis, so that's good too. I'm going to pull down your eyes here. I want you to look up for me. So the conjunctiva is nice and pink. Sclera is nice and white with red blood vessels. Cornea is nice and clear. The irises are beautiful blue and round and equal on each side. And your pupils are nice and equal too. So I'm going to shine this bright light in your pupils. Okay, I want to look at how they change when I shine the light in them. Very good. Sorry about that. Very good. So his pupils are equal, round, reactive to light, and exhibit accommodation. Oh, let me check this accommodation here. I want you to look here at my finger. And then
I see a lot of spots.
that's okay. That's normal. And then I want you to look back at that wall when I tell you, okay, look at my finger. Now look back at that wall. Very good. So I'm seeing accommodation, so that's bilaterally and consensually also. So then also I want to palpate your lacrimal sacs here. You're not having any pain there when I push, am I?
Nope.
Are you rather? Good. Okay, good. So that's good and normal. Okay, so now we're going to do the ophthalmoscope exam. Here, let me switch over my tool here really quick. So I'm going to shine this bright light in your eye here, and it's going to allow me to look at your retina, which is pretty cool. There we go. Very good. Hang in there. Okay, so the lens is nice and clear. Well done. Lens is nice and clear and the red reflex is present. His optic disc is about 1.5 millimeters in diameter. It's yellow and nice and round with clear margins. No evidence of cupping. His retinal vessels I'm seeing both arterioles and venoles. So the arterioles are brighter in color. They're both red, but brighter in color. And the ratio is about 2 to 3 or 3 to 5 for those vessels. There's no evidence of venous nicking or crossing. The retinal background is nice bright pink orange, mostly orange, and there's no evidence of hemorrhage or exudate there. And then the fovea centralis is visible there at the center of the macula, and that's a nice little gray round circle, nice regular shape. Okay, so that's about the halfway point. So let's spin this camera around. Yes, we've got you on a swivel here, so you can see what's going on. That gets the whole center?
Yeah.
Good, okay. And those are our cute ultrasound pictures on the bridge.
Right that gets us back to where it was, kind of.
Cool, okay, good. Okay, so now I'm going to take a look at your ear. I want to look at the auricle here, which is nice and regular shape, nice pink. There's no lesions, no redness, swelling, or tenderness. None of this is tender, right, honey? Mm-hmm. Good. Very good, and then your mass right back here behind the ear as well. I'm going to grab my otoscope. I got to switch my tool back. Here we go. So I'm going to take a look with my otoscope here. I'm going to look through the external auditory meatus through the ear canal, which is the entrance to your ear canal, through the ear canal to your tympanic membrane. That's your eardrum in there. So I'm going to do that, I need to straighten out your ear canal, so I'm going to pull the pinna up, back, and out. Yep. And so your tympanic membrane is nice gray smooth. You can see it innervated with blood vessels there, and there was no bulging or pulsating. So that's good. So now I want to check your hearing. So that's going to be your acoustic nerve, which is cranial nerve, not 3, 8. Cranial nerve 8, that's 8. What it is. So I want to come stand behind you a little bit, so face the camera for me so that you can't see my lips move. I want you to cover up this ear over the side, plug the ear so you can't hear out of it. I'm going to whisper.
Well, there's not outside.
Good. So we've got good hearing on that ear, and we would do that bilaterally. So now we're going to test conductive hearing, and we're going to do that with the Weber test. You might have to help me hit this hard enough. We'll see.
You can do it.
Okay. I want you to tell me if you can hear the sound equally in both ears.
I can hear it equally in both ears.
Okay, good. So that's no lateralization, which is good. That's a normal finding. So now we're going to do the Rhine test. And the Rhine test, I'm going to place this tuning fork, I'm going to hit it, then I'm going to place it behind your ear here. That's going to check for bone conduction. I want you to tell me when you can't hear it any longer. Then I'm going to hold the still vibrating fork out here right outside your ear, and then I want you to listen and tell me when you can't hear it any longer outside your ear. Okay. Normal finding there is that it takes twice, the air conduction takes, you can hear for twice as long as for the bone conduction. So let me hit this again here. You ready?
No. No.
Okay, good. That was about right. I think I didn't hit that very hard.
No, last time you hit like twice as hard.
That's okay. Okay, so, alrighty, that was your ear. Let's move on to your nose here. I'm going to inspect your nose for size, shape, and symmetry. Nose is nice and symmetrical. Yeah, I haven't even broken it. That's good.
You see I have a big nose.
No, you have a nice normal shaped nose. That's a good size for your face, honey. Look up for me. I'm going to shine my light in your nose here. Yeah, there we go. So I'm inspecting here on both sides. Looks patent to me. The nasal mucosa and turbinates are nice pink and smooth in there. And the septum is midline with no deviation. Lucky you. So then at this point we would also check his olfactory nerve, which is cranial nerve number one. Yeah. So, and we would do that. I would have him hold one side of his nose and smell a familiar smell like maybe coffee or vanilla, and then have him identify that smell, and we would do that again on the other side to make sure that you're smelling equally on both sides. Then I want you to check your patency of your nose. So I want you to occlude one there, yep, and breathe in and out, and occlude the other side and do the same. Good and patent. No allergies today.
No
That's
allergies
good news. So I did want to point out that Andrew has a little bit of a lesion here on the entrance to his nose. He suffers from impetigo, so he's got a small lesion there. So I think that's all the nose stuff. Okay, let's move on to your mouth. So I want to inspect your mouth. I want to inspect your lips, nice and pink and smooth. They're not even chapped. Open your mouth for me. I want to look inside your buccal mucosa here. I'm going to inspect your hard and soft palate and your tongue, your teeth, nice and white and smooth. Yeah, good. Lift your tongue up for me. I want to look under it. I can see the frenulum. I can also see the Wharton's and the Stenson's glands, ducts rather, that's where your salivary glands are. Frenulum is intact. So stick out your tongue for me. Yep, and I want you to say ah. Stick your tongue way out, way out. Ah. Good. Okay, so I can see his soft palate rising back there when he says ah, and also his uvula is midline. I would also palpate your tongue and your hard and soft palate, but I don't have gloves and I'm not going to stick my fingers in your mouth. You're welcome. So your cranial nerves 9 and 10, that's going to be your glossopharyngeal nerves and your vagus nerve. That innervates your, that's your motor nerves. They innervate your mouth and your throat for speaking and swallowing and gagging. And you can handle all those things, so that's good. That's working well. And then stick out your tongue for me one more time. Maybe on. So that's demonstrating that his hypoglossal nerve, that's cranial nerve 12, is functioning appropriately. If it wasn't, or if it wasn't functioning bilaterally, then his tongue would deviate to one side or the other, and we're not seeing any of that, so that's good. All right, so let's go ahead and move on to your neck. I'm going to look at your neck here, and I'm palpating your trachea right now and your cricoid cartilage. It's pretty visible for me without palpation, but I can feel it as well. Trachea is midline, nice and normal. Let's see. So I want you to swallow for me. Yeah. So I can kind of just barely feel his thyroid moving up when he swallows, and the best way to check this is from behind. So I'm going to deviate over here with my left hand while I palpate with my right. Can you swallow again for me, honey?
Kind of.
I'm sorry.
It's
Okay,
kind of
good.
hard with all that pressure on my throat.
You did good. Good job. Okay, so I'm feeling it very slightly moving up and down, which is good. And then I'm going to listen to it as well. So what I'm listening for is I'm listening for any movement in the blood vessels called a pruee. I don't want to hear that. That is an abnormal finding. Yeah, and I'm just hearing breathing sounds, so that's good. So I also want to feel your carotid artery here. Yep, and he's got a nice, good, strong pulse. And I'm going to auscultate that as well. Yeah, good. So no breathe there either. Just a, you can hear that nice, strong pulse. Okay, so also with your neck, I want to palpate your lymph nodes. And I might be able to get down most of the names for these. Let's see here. So I want to check here your pre and post auricular. That's before and behind your ears, yeah. I'm going to check here for your retropharyngeal, submaxillary, and submental.
And that kind of hurts back there.
Okay, I'm sorry, I'll be gentle, sorry. Lymph nodes, good. So I'm going to feel down the side here. Here are your occipital nodes. I'm going to feel down the side here. These are deep and superficial cervical chain all the way down.